My name is Janice Tufte. I live in Seattle, Washington, and I'm a member of the ABIM Foundation Trust Building Advisory Panel. It's comprised of patients and caregivers who are working to develop opportunities in how to build trust with clinicians and other healthcare providers. And I'd like to share a recent story that I experienced. So I've had an opportunity to participate in multiple stakeholder efforts locally where they're kind of like think tanks, but where we discuss subjects. And we had a recent one on equity and social determinants of health, but primarily on equity and how to address racism and anti-oppression. And during the call, during the webinar, I had mentioned something, and a gal had texted me or chatted with me and stated we should really get together. And she's at the local essential hospital, the Safety Net Hospital, Trauma One Hospital, Harborview, which is part of the University of Washington Health System. And I said, yes, I'd love to. So she set up a Zoom call for us, and we've been doing it once a month and getting to know a little bit about each other. It's part of Harborview's mission, actually, to get to know different community members and groups within, tackling diversity, equity, and inclusion. And so we had one call and we shared a lot of resources. On our second call, she mentioned to me, have you had your COVID-19 shot yet? And vaccine. And I said, no, I actually I just fall right out of the realm of them, and I'm not willing to tell an untruth to acquire it. So she just took note of it, and she goes, there might be opportunities for you to have a vaccine with extra vaccines at the end of the day. Are you interested? I said, yes, I most certainly am. So it turned out a couple of weeks later, I received a text from her, and she said, would you, if you had an opportunity to have your vaccine today, would you like to have it? And I said, certainly. And a part of the story I forgot to mention is that it was before Ramadan, and she mentioned that the Harborview was doing outreach to communities, the Muslim communities. We have many refugee communities as well as different communities that are of Islamic practice here, and they were reaching out actively to ensure that they had their vaccines before Ramadan, and because they might have a little bit of a reaction and they don't want to feel bad during Ramadan. And so so I was very fortunate. I got a call at 3:00 from the doctor that Saturday, and she said, can you be here in 15 minutes to a half an hour? And I walked very quickly to the Odessa Brown Clinic, which is a neighbor clinic that was developed by an African-American woman many decades ago, and serving some of the most vulnerable community members, but really with the care that is needed, because it's very representative. The people that work there are very representative of the population in the area. So I walked there, and I had my second vaccine days before Ramadan started at the same clinic. They were able to they gave me a date and time to come back, which I really appreciated and think is important. And I just can't thank her enough. And this trust building effort comes off of, attending community meetings where different individuals come together. At these particular group meetings we are at, there could be, the head of a hospital, there's heads of department, there's frontline staff, there's community health workers, translators, and patients all involved. So this is an excellent way to build trust building, and also to build opportunities where both parties or all parties can really benefit from one another and can reach out to each other if they have questions. Maybe perhaps somebody might like to know if I know of a patient in a certain area that's involved with design or that's involved with social determinants of health, and I could assist them in finding somebody. So trust takes time, and we had multiple calls, and we've met each other over the year, with meetings and our Zoom calls. And through that opportunity, I was able to have my vaccine before Ramadan, and this really was culturally appropriate care. And I hope that this type of care can be presented and seen throughout the nation.
Visit buildingtrust.org to learn more.